The budget hearings have been told of a big drop in the number of nurses working in Tasmania's public health system. The equivalent of almost 300 full-time positions have been axed since last July. Here's state political reporter Brad Markham.
Back at budget estimates and armed with figures.
Now the LGH in February 2012 had a number of instances of 62.
Last year, the Health Minister refused to reveal how many jobs would be axed as part of $100 million worth of cuts. Today, Michelle O'Byrne produced a number. The Health Department has shared the equivalent of 651 full-time jobs since July last year.
It absolutely gave me no pleasure to have to find and authorise and be responsible for those decisions.
Can you run through where these jobs have gone?
Nurses appear to have borne the brunt of the pain. The equivalent of 287 full-time positions have been axed since July.
How are we going to cope with our frontline service delivery when you are sacking a nurse a day out of our health system?
Not all of the nurses were sacked. A number were on short-term contracts and were no longer needed after major cuts to elective surgery.
Along with that decision was the issue around bed closures, and that's where the nurses' savings came from.
Slashing the size of the nursing workforce hasn't come cheap. 10 redundancy payouts have cost the Health Department $722,000. A workplace renewal program saw incentives paid to 40 nurses at a cost of $630,000.
It is a cost, but it's also a cost that reflects our need to engage in a changing work profile.
The opposition is keen to know if more jobs are on the chopping block.
How many more full-time equivalent nurse positions will be gone between now and the 30th of June this year?
Target, there's no target we can say that we're attempting to get rid of X amount of staffing. What we are doing is attempting to reduce the cost of episodes of care.
A vital exercise if the Health Department is to meet its budget next financial year. Brad Markham, ABC News.